All right. Hi, everyone. I'm Debbie from the Healthcare and Science Career Community. I am here with Betsy, also from the Healthcare and Science Career Community. And we are here with a panel of three fantastic DePaul alumni. I'm here to talk about the business of healthcare. So we're going to be highlighting alumni and their career paths in kind of health and business, and learn a little bit more about how to get a job in this industry as well. So I'll let the panelists introduce themselves, and if you could each introduce yourself, tell us about your current job and how you got this job, maybe your background, any previous experiences, graduate school, internships, first job, etc. So Ciera, why don't we start with you?
Absolutely. Well, thank you for having me again, Debbie and Betsy. It's a pleasure. So my name is Ciera Hester-Smith. I currently work for Pinnacle Dermatology. I'm their Regional Director of Operations. I actually am a 2014 DePaul alum. I graduated from the School of Hospitality with a major in event management and a minor in marketing. So very different world than working in healthcare. By the time I graduated at DePaul, I had the opportunity, I had been interning and working part-time at Rush University Medical Center. So I had the opportunity there to have my first interaction with patient care. And then by the time I graduated from school, they offered me a full-time job. So that was kind of my transition into the healthcare world. And it's been great. And I've remained in this field of work for the last 10 years, actually. So currently, as I mentioned, I work for Pinnacle Dermatology. So I oversee 10 of their clinical locations out in the western suburbs. So I spend a lot of time in my car, which is always exciting. It's a different place each day. But the biggest things that I truly get to focus in on are not only patient care on the day-to-day, but I have the opportunity to work with office managers, physicians, nurses, PAs, their support staff. But then I also have the huge beneficial opportunity to work on the growth and strategy side as well. So I have the opportunities to talk about what new markets we're going to branch into within the western suburban area, in addition to what offices we are going to acquire, and then helping with all of the IS and technology teams on integration and working with finance on P&Ls and budgets and things of that nature to make sure that we're not only making right business decisions, but then in addition to making sure that we are providing the utmost support to offices that were either starting brand new or moving into acquisition as well.
Thank you so much. Aldo, if we can have you introduce yourself and talk about your current role and kind of what led to it.
Yeah, absolutely. Hey, everyone. Thank you for having me today. My name is Aldo Basha. I currently am a finance manager working at Medline Industries up in the northern suburbs. I'm currently supporting our operations business. So I'm responsible for all 40 plus distribution centers across the country and all outbound freight activity going from the distribution centers to the customers. We support probably over half of the health systems throughout the United States. And so my job is to make sure that we work with the branches, distribution centers, help them towards their labor goals, make sure they are financially stable. I've held a couple different roles on Medline. This is my third role at Medline. I supported sales prior to this, and I also supported product divisions, so new product development. I actually started my career out at Walgreens. I was there right out of school. Actually interned there while the summer between my junior and senior year at DePaul. And I spent 4 years at Walgreens. I went through their finance development program, which is a 2-year rotational program. Once I graduated that, I stayed another year. And I also worked my entire year of my senior year at Walgreens. Graduated DePaul in 2014, like Ciera. So I'm happy to be here and be able to give back and share some of the knowledge that I've gained over the years.
Thank you so much. And Michael.
Hi, and thanks for having me as well. My name is Michael Reynolds. I currently work as a customer success operations manager for a company called HealthJoy here in downtown Chicago. The current company I work for, HealthJoy, it works my whole kind of career experience has kind of existed and kind of predicated in some ways upon just how complex healthcare is in the United States. So for example, my company now, we work as part of a benefits package. We exist in this really interesting space between employers across the United States and their insurance brokers. And so we will connect with their benefits package and become like a part of that. So familiar with their benefits package that we offer a concierge service with the goal towards helping employees across the country make better, smarter healthcare decisions. So instead of like if you were to, like I did, like I really hurt my ankle one day and I ended up going to get an x-ray. I went to like a hospital, like Advocate Masonic here in Chicago. But instead, if my company would say, hey, you know what's actually going to be a little bit more cost effective is if you go to this outpatient facility that's still in network for you based off your health insurance. We also offer telemedicine access. And what we're looking at is a little bit more of like specialty kind of care management moving forward, all towards the goal of helping individual people reduce their out-of-pocket spend, because it's also going to reduce the out-of-pocket spend for their employer as well. But my trajectory has been it's been interesting. I'm from Ohio. I graduated with a Bachelor of Fine Arts in playwriting. Eventually, after college, I eventually moved to Chicago and just worked in luxury retail for a while until a friend of mine said, you should join this startup company. And that's been kind of my trajectory. Is I've worked in Chicago tech startup spaces, but around healthcare, working in patient education and now benefit satisfaction. So yeah, I think that's my intro.
Thank you all so much. It's cool to hear kind of how your academic backgrounds kind of continued, but also differed from what you're doing in healthcare business. And just a reminder that what you major in doesn't have to be your career, but it can be. And it can also kind of give you, different opportunities, and the career path is definitely not linear. It goes in many different directions. So we know that a lot of students and alumni are searching for jobs. Lots of people are changing jobs right now. So for our panel, what kinds of skill sets do you look for when you're hiring? And Aldo, we'll start with you this time.
Sure. Yeah. So I break skill sets out into two different buckets, right? We have technical skills and then soft skills, right? So we'll touch a little bit on both. When it comes to your technical abilities, particularly in finance, if you're working in finance, whether you're in healthcare or not, right? Having solid Excel skills will serve you very well, right? It's very common to see Excel used across different industries, across different companies, right? It's almost one of those like foundational tools. So being good at Excel, right? Beyond the VLOOKUP, SUMIF kind of functionality, right? Being able to build models, build tools for yourself, right? To make your job easier and to advance the role that you're in. Along with that, what we've seen is that SQL has become more and more important. And so within Medline and at Walgreens, we use SQL to extract data and work with larger data sets. And so being able to manipulate large data sets, write the code to extract whatever you need and not what you don't. Excuse me, that's very important to us here. A little bit on the soft skills, right? It's very easy to see that if you're at Medline, if you're at Walgreens, most companies, right, that startups like Michael may be able to attest to, that entrepreneurial spirit is super important, right? Act as if it's your own company, bring energy, the things you can control, those are super important. So definitely something that we look for when hiring. In addition to that, it's collaboration, right? You'll be working with large teams, similar to like college where you work with group projects. You'll be doing that just en masse, right, in the workforce. So being able to demonstrate that you're able to work as part of a team, able to not just lead a team, right, but lead thought processes, right? Be a thought leader, think about ways to change the current status quo, right, and challenge it, and not be afraid to speak up, right? So those things are super important to us when we look for hiring.
Thank you. I appreciate hearing about kind of the hard skills and the soft skills as well. Michael, what do you look for? What kind of skill sets do you look for in hiring?
Yeah. Yeah, I gotta first start with the great foundation as far as the technical skills that Aldo mentioned. I know I myself, years ago, listed proficiency in Microsoft Office Suite without, I only just now have started to really, like the VLOOKUP reference really hit home with me. It's like, I remember when I learned that, I thought, wow, the world has changed. But with that foundation understood that like the technical skills are becoming, not just can you load up Excel, can you model off it is quite critical. But I would add to that as well. The soft skills as well. So in my previous role, actually the last 2 jobs I had prior to this company involved direct contact with people, whether they were customers in a store or my last jobs actually saw me traveling and speaking with healthcare providers out in various aspects of the country, out in a large hospital system. And being able to communicate was something that we always kind of look for when we're hiring, for example, our customer success managers, our CSMs over here at HealthJoy. The ability to like be able to trust that this person's going to eventually be able to go out into the field, hopefully. And like we work so hard to build and maintain relationships. It's good to know that we can trust that those relationships are going to be maintained with somebody that is able to communicate effectively with people in person, or even through our new Zoom-based realities. And I know that I in particular look for that when it could be the theater background and my theater background and me coming out, but I know when I'm interviewing people, I particularly resonate with somebody when they hear the question and they like take a moment just to and I am able in that moment to see that they have heard the question, they are processing it, and it's not a canned response in the sense that, you know, like it's interview prep is always fantastic, but for me, I am able to gauge the ability of someone to communicate with somebody in person if they are able to take what they've heard and respond to that actual question, including all the context of the questions that led up to it. So like Aldo said, firm foundation in the technical aspects, but also adding on to what he had mentioned about the soft skills, it's being able to communicate is perhaps more necessary than ever, because now we're operating in both an electronic and in person, hopefully and soon in-person sphere again. So that's kind of what I'm looking for when I speak with candidates.
Yeah, thank you. Important to think about the kind of the improvisational skills that you maybe have from your art background and theater background. Ciera, what do you look for? What kinds of skill sets do you look for in hiring?
No, absolutely. So again, definitely touching on my 2 co-parts, again, with the technical skills. And yes, the Excel piece definitely opened my world moving into after I got out of college. Again, you think you have a basis understanding of it, which is great, but it's not really until you start getting into your companies that you really start to do a deep dive and understand what that is. But for me and what I look for, especially because all of my team is patient facing, is I look for those transferable skills that you can move from industry to industry. One of the biggest ones being customer service. I will get interviewees that apply for positions, but maybe have not had a lot of face-to-face contact. And sometimes that's tough because you have to be able to speak to patients in a certain kind of way, listen to them and answer questions, and be able to provide that kind of feedback back to your manager, myself, and or a physician. So you definitely have to be an effective communicator. And sometimes, again, being able to understand and be relatable to what the patients are looking for makes it a very good patient interaction from there. In addition to the technical, and again, some of the additional transferable skills of customer service, I'm also looking for candidates that are truly empathetic. They have to be able to show that in some sort of way, not necessarily in gestures, but again, sometimes patients that are coming in, we work with patients that come in with skin cancers, and you have to be sensitive to that information. And granted, it may not apply to you directly, but you have to be able to show that communication, give patience, and be able to talk to them when they come in.
I love that. I think we're thankfully hearing a lot more about the importance of empathy kind of across businesses, but certainly, especially in healthcare, that's super important. And I love that you brought up transferable skills. We are very big on transferable skills. So that the customer service piece, maybe a student is working in retail or in a restaurant. You might not think that that's really valuable experience, but actually that customer service experience can help bring you into another stage of your career.
It is. I look for a lot of people that come out of hotels and retail and the restaurant industry, because again, you interact a lot with customers, clients, and again, it's very much focused on them at that point in time. And so you're all about creating a great experience for them, whether it's shopping and or dining out. So those are definitely people that I look to hire and bring into my organization.
And I think Ciera makes a really good point that actually bridges something Aldo had mentioned earlier about that sort of entrepreneurial spirit, where if you know that you're going to be speaking with patients that maybe have a condition X, Y, or Z, understanding that, knowing more about that condition, like taking it upon yourself to learn what that patient might be going through, what are the symptoms, what could they be dealing with day in, day out, will help you just speak to will allow you to be a little bit more sensitive in your approach, perhaps, or it will really tailor how you feel towards it. And like kind of what Aldo said earlier, like my background's primarily in the tech startup world around healthcare. And there really is, we always do look for an entrepreneurial spirit. Like an example, like some of our interview questions will be, when did you notice something was going wrong at your previous employer? And like, what did you do to fix it? Did you take it upon yourself to, like, yeah, I saw this was an issue, and maybe it's how maybe you're addressing patients, but it's that entrepreneurial spirit of saying, I saw an issue and I did X, Y, and Z to correct it, and here was the outcome. Here's how it benefited my coworkers, my employer, the patients, whatever the case may be. I thought that was a really good point here and Aldo earlier.
Just wanted to, this is such amazing insight. Thank you all for sharing. And I just wanted to pop in with a couple of resources that might be helpful for our current students or alums as they're, looking to think about this idea of skills and those hard skills, soft skills, those really important transferable skills that we talked about, and how students and alums can think about upskilling. There are so many different ways to develop and hone new skills, including some things that our panelists have mentioned, like internships and jobs while working in school, class projects, really looking for ways to leverage those opportunities to develop your skill sets to help position you for those jobs that you might be interested in down the line. I also wanted to mention LinkedIn Learning, which is a platform that current DePaul students have free access to, that has a ton of online courses and modules and videos about a range of topics, from very technical skills about how to do specific things in Excel, as well as some really great insight and content on some soft skills as well, things like empathy and communications. So I would definitely encourage current students to check out LinkedIn Learning. It's a really fantastic resource. And then I also really loved and appreciated some of the information that our panelists gave around interviewing. And Michael, I loved what you mentioned in terms of interview preparation, but also being able to be nimble and responsive in an actual interview setting, to really listen to what the interviewer is asking you and take time to think about answering that question. I work with students a lot on doing interview preparation and mock interviews, and sometimes students have done so much practice that when I ask them a question, they actually give me an answer to a different question. And so I think that your point was really great about, taking time to prepare for interviews, but by doing that and being prepared, it will help position you to be able to actually be responsive and be a great listener and answer the questions that the interviewer is actually asking you when you're in that setting. And we have a lot of interview resources for students and alums, including a bunch of resources in our online career library that have some sample interview questions, tips on how to prepare for your interviews. And then, as I mentioned, we also do mock interviews with students and alums too. So definitely reach out to us for assistance there. Thank you all again for that great insight.
Yeah, so I know we have gotten a little bit into some interview advice, but I'm curious what other advice or thoughts that you have around interviewing for students or alums who might be preparing. What have you seen in successful interviews? What have you seen in maybe less successful interviews that would be helpful for our students to know? And Michael, we'll start with you this time, since you kicked off our discussion on interviewing.
Sure. I think my philosophy is usually, and I don't know if this is industry standard or if even my colleagues agree, but I generally feel like if you are interviewing, you you have the skills to do it. Like, so especially depending on the size of your company, you might have first done a phone screen, say with like a recruiter or somebody that works at the company whose job is to find recruits. So by the time you're interviewing with like managers or potential coworkers, like I feel like you can do the job. It's also a matter at that point of, can we work with you? Like, this is where the soft skills come in. Like, because, ideally you're bringing something on. A lot of companies, when they hire, they need/want to retain you. It is expensive to have to backfill positions or fill positions because someone left, and they always, like, the goal is to retain you. So I always just feel like, try to calm down. You're like, you can do this. It's just be yourself. And a lot of times being yourself also means doing that little bit of research about the company ahead of time, just to get enough of an understanding. You'll never know the insides of another company you're interviewing for, but to get just enough of their what they do, so that when you're talking about yourself, it's like, oh, I know you guys do this. It reminds me of a time I did that, or took the entrepreneurial spirit and did that, or something to that effect. But just a little bit of understanding about what the company does will help you tailor your responses as they try to get to know you off your resume, off the sheet in reality. So.
All right, thank you. I love that if you have made it into a second or third round, that you likely are very qualified. So it's just kind of about communication and personality and soft skills. Ciera, what would you add?
I would definitely say, I know it's tough, obviously, being in this transition between people are going back into the office and conducting interviews and still doing interviews via Zoom or Teams or whatever it may be. But it's still just as important to come to your interview prepared. Make sure that even though if you are at home, you're still dressed very nicely. Even if you do decide to have a pair of basketball shorts on but still just making sure that you come prepared, you're dressed appropriately. And I think the other biggest thing is that I look for in interview candidates, I appreciate when they actually take not only the time to do research on the company and or the organization, but sometimes if they do find me on LinkedIn and they say, oh, I realize you did go to DePaul, and how was your experience there? Or I see that you did work for Rush, like I've done an internship there. How was it? It actually shows that you took the time to research the company and to add some value to that. Because as Michael just stated, it is very, very costly to bring on new employees, keep them engaged and retain them. So it's just as important to make sure that we are offering that as a candidate, you're showing that your interest, so that we can, again, bring you on board and make sure that it's a good fit for everyone.
I love that. Doing just a little bit of homework. There's so much information available via LinkedIn, via a company's website, social media, etc. So definitely take the time to look through it and to find those personal connections. And Aldo, what would you add?
Yes, I think Ciera took my number one, and it's a great one. It's you control what you can't control, right? Number one is how you present yourself, right? When you sit down at a restaurant, you eat with your eyes first, right? If the food looks good, it's going to probably taste good. You already have a predisposition to liking the food, right? Similarly, when you meet someone, they're well dressed, right? They present themselves clearly, concisely, speak in full sentences, not in half phrases. Those are the controllables, right? So control what you can't control. Come prepared, look prepared, right? Know your resume inside and out. There's no reason to have to look at your resume while speaking, right? It's your writing. You should know it, right? Then you get into the profession itself, right? When you're having a conversation, make it a conversation, right? In the very beginning, if you're asked to give an introduction, I've seen some people that they regurgitate every line on their resume, almost reading as if they were reading it. I've read the resume. You're here because I've looked at the resume. To something Michael said, the recruiter's already looked at it. We've had an introductory discussion about you, right? Which is why we've passed you on to the next round. And so there's no real need to regurgitate every single line on the resume. I've read it. Let's have a conversation about why it is that you're here, right? What do you want to get out of this role? What do you know about the company? I think that's something, that both of the panelists touched on. What do you know about the role you're trying to get, right? So all of those I think are very important. Sound a little basic, but the less more formal and you're hitting every single bullet on every single role on your resume, the easier the conversation will flow, and that will naturally just resonate with the person you're interviewing.
Thank you. I love that about controlling what you can. I think that's definitely true in an interview situation, and also when you start a job. You can control what time you leave for work, if you have to be there in person, what you're wearing. I also like to tell people you can control what you pack for lunch, so you can bring a delicious and healthy lunch for work, and you can take some control over your environment.
I'll add one last thing that I
Yeah.
neglected to mention was, I think Ciera touched on it when it comes to interviewing over Zoom, right? Have your video on, right? People like to see other people. Put yourself in a space where there are not distractions behind you, random posters or something, right? If I was interviewing right now, I wouldn't have 2 motorcycle helmets behind me, right? I'd have probably been a more kind of neutral background, right? Where I'm not having anyone focus on anything other than me and what I'm saying, right? So those things I think are also important when you're virtually interviewing.
Absolutely. We also like to recommend, if you can close the door, if you have a private space, to use that. If not, to definitely, or regardless, to tell your family or your roommates, that you're going to be doing an interview, and to ask them not to disturb you, just so that they are aware that you're going to be doing this, and so that you can have that distraction-free background.
On this topic too, we have a whole handout about how to have a great video interview, which is, particularly timely now amid COVID, but is also, a trend that had started even pre-COVID, and that I think will continue into the future as well. And so I'm just going to drop a link to this resource called Mastering the Video Interview here in the chat. And it echoes a lot of the same tips that our great panelists have shared.
Yeah.
And kind of bringing, I think, something Aldo had said earlier, and I think Ciera touched on this as well. One part, I think, another bit of advice as far as when you're doing that research about that company, it's less, I try to think of it less as like, this is a part of a prerequisite to the interview. And it's more like, I try to think of it as you're doing research for your own life as well, because this is a company that you're going to be going, ideally you'll be going to work like every week. And so being able to ask questions about how does the company operate? How would you describe, what is the culture there? What does that mean to this company? Trying to get an idea of because this is for you, you're going to be going here every day. So and everybody notes, I think, if someone asks really good questions about the company, something that says I'm trying to put myself in what it's like to work here every day. And they oftentimes it's helpful for them to be like, what was it like when you joined? What was your onboarding like? Just asking questions of your, the question session at the end of every interview is your opportunity to put yourself in the role of the day-to-day employee, I think. So we always look to see oh, this person asked really good questions at the end. So
I feel like, Michael, thank you. That is a perfect segue into our next question about, thinking about what is it like to work at this company? What work-life balance is a concept or a term that's thrown around a lot. And sometimes I think it's hard to figure out what that means. And as things are changing in our hybrid or remote environment, but what does a healthy work-life balance look like for you? And Ciera, we'll start with you.
Okay, so for me, again, all of us on the panel, we have our different experiences within the healthcare market. So for me, one of the things I always explain to anyone that's coming on board and that I try to keep in mind for ourselves is that at the end of the day, we want to make sure that we are offering enough availability for all of our patients that are coming in. So I do have some clinics that work very long days, 7 to 7. And even for myself, if I happen to be out of that office for the day, one of the things that I always make sure that the staff knows is that if you need to take more than just your 1 hour lunch break and the 15-minute break, in the morning, you need to take 20 minutes or take a little longer. It's, again, all about communication, because we know that 12 hours is a long day to be in clinic and working with patients, and it's tough. So if you need a few more of those extra quick little breaks, just step away from the computer. I always tell my team, I'm like, it's gorgeous outside, go take a walk around the building. I do the same thing because sometimes you just have to pull away from the computer, especially if you're sitting in front of it for so long. Also, I think the biggest thing is for me, and something that I'm probably still working on, is just being able to, that when I get home from work, I have to put my work phone down for a little bit and make sure that I actually take the time to take my dog for a walk, start prepping dinner, spend time with my partner, and actually just kind of focus in on things that I just enjoy doing, whether it's being on social media for a little bit or just skimming through a couple of magazines, whatever it may be. But taking that time to truly step away from the job is important because, again, my days start pretty early. It's usually about 5:30 that I'm up, and I could easily still be on my phone, checking emails, answering calls until 8, 9 o'clock at night. So I think that's one of the biggest things, is just taking that time to make sure that when you truly get home or wherever it may be, that you're truly taking that time to step away and focus on what's at hand, even if you're going out to dinner with friends, truly putting the phone away and taking time to enjoy the people that are right there in front of you.
Thank you. I think that is such a helpful reminder for all of us to be fully present, especially in our downtime. Aldo, what would you add?
Yeah, I'd say the definition of work-life balance has probably changed a little bit with the pandemic, right? And so prior to this, we were in the office every single day at Medline, and work-life balance was a little different, right? We're lucky enough to have a campus that has a couple mile track around the entire building, beautiful landscaping, right? We have outdoor and indoor basketball courts, a workout facility, right? So work-life balance meant taking some time to use all of that and not just look at it from afar and say, hey, that looks nice, I wish I could play. And so that's absolutely part of it, whether it's your lunch break before work or after work, right? In the office, it also meant the commute. So like I mentioned, we're in the northern suburbs. And sometimes if you lived in the city like I did, and you were commuting on 9094 coming home from work, driving into the city on a Cubs game, right? I live right by Wrigley, so Cubs game, Bulls game, Sox game, Bears game, or you hit the trifecta on any one of the 3 of the 4, right? It's not that fun. And so that also means flexibility, right? Work-life balance means flexibility of, hey, there's a Cubs game. Do you mind if I head out a little bit early? I'm not trying to sit in traffic for 2.5 hours just to get home. And that's totally reasonable. At home, work-life balance maybe means something a little different, right? We're already in the comforts of our own home. And if you're lucky enough to have a space where you can, separate your work life and your home life, that's great. Some folks don't have that luxury. And so sometimes that means that, their hours have to be maybe a little more strict just to be able to, dissect those two worlds a little bit better, right? Maybe that means, how do I think about, being on video or my surroundings behind me, right? Maybe that means, hey, I have to go to a doctor's appointment, right? And can I cut out my lunch, be not an hour today, but an hour and a half, because I have to go to the doctor and it's the only time they're available, right? Sometimes that also means taking time off and making sure you use your PTO time, right? You need that time away to not get burned out. I think it might be a lot easier to get burned out. Sure, you're in the comforts of your own home a little bit more, but it's that much harder to separate your home life and your work life. So take the time, take your PTO days, some time to yourself. That's equally important, right? If you're right mentally, physically, right, you're gonna perform better in the workplace. So those things are very important. So depending on whether it's the office pre-pandemic or maybe in a hybrid model post-pandemic, work-life balance can mean a few different things. And so now how it's incumbent on us, and our employers, our managers to give us some sort of balance, right? Going into what the new, going back to the office, kind of returning back to life. What does that look like?
Thank you. Yeah, I think it is very helpful to think about flexibility and what works for you and not getting stuck in 2 hours of traffic, because no one should have to do that. And Michael, what would you add?
Yeah, I don't know that I can really add a ton of new other than just underline what Ciera and Aldo have said. I will say I've really appreciated my current COO's mentality, who has kind of just reminded everybody in it's a couple different ways, just a reminder that we're all people. You know, there is an entire world of our lives outside of this particular office, and you know, I've really appreciated it, just the acceptance and understanding that he tries to put out toward the organization of just like, yeah, like if like what Aldo said, and I think when Ciera said, like, if something happens in life and you need to take like an hour, hour and a half, 2 hour, whatever the case may be, I've appreciated the mentality that I think is gaining more traction these days, where it's just, you get your stuff done, and it doesn't really matter if it's within a specific 9 to 5 window. And to that point, I have also pre-pandemic, when we were back in the office daily, I really tried to make it a point to like eat lunch or something, and the rest, like, really take the hour. Like if that's what your company generally accepts as, like, maybe it's 30, 45 hour, just whatever was left, I just would go for a walk around the office, like different parks around here in downtown Chicago, like whatever the case may be. I just really try to use that time. Like if that's what the company accepts, you have an hour, use the hour. Otherwise, you know, burnout, I like kind of what Aldo was saying, I think it's a term we toss around a lot these days in the media, news, whatever the case may be, but it, you know, it can be real. And so taking the time, giving yourself a breath, I think is important.
I know I always feel better after taking a walk, whether that's, you know, working from home or back when we were in our office on DePaul's campus. There's so many places to walk around, either in Lincoln Park or in the Loop. So that was definitely very helpful and continues to be. So, of course, kind of the elephant in the room, the pandemic, being in healthcare. I know this is kind of a very broad question, but how has your organization changed since March 2020? That can be kind of what you're working on as an organization or how you approach work, but how has it changed since the start of the pandemic? And Aldo, we'll start with you.
Great. Well, yeah, very broad question, right? So we'll just start with we'll bucket them. So number one, the impact to the people working at the company, right? We have, 40 some distribution centers across the country, and those folks were on the front lines of the pandemic. True definition of healthcare workers, frontline workers, right? Making sure hospitals, other places of care receive the medical products and supplies they needed to, take care of patients, who were feeling sick. And that's a very long time, right, to have the focus on this subset group of people, right, nonstop. Our service levels were very important, making sure, we got the right product to the right place at the right time, on time, every time, right? That's very important. And so, that subset of people, right, employees across the company certainly have a lot on their shoulders, right, and definitions of heroes going in every single day to fulfill the orders. So that's one. The other, I'll call half of the organization, folks who weren't working in the distribution centers like myself, right? We were given care packages to ensure to be safe, right? When we're either at home, they had supplies in there. There were masks and disinfectant, right? Wipes, things like that. So those were great to see that the company took care of the employees. Right. Then you talk about how our business changed, and that was kind of pretty crazy, right? It happened to everyone all at once. For us, being able to get product was difficult, right? There was a rush of people, companies, governments looking to procure PPE, right? And that was a big deal, and so we had to work through that. And you've seen maybe on social media or the news, right, that Medline was one of the companies that partnered with the U.S. government to get product from overseas to the U.S. that we would give to, we distribute to the healthcare system. So that was very important. Those are things that we didn't have to do before, we've not done before. So that certainly was different. And then our customers' needs changed, right? We effectively saw elective surgeries come to a halt, right? Folks weren't going into hospitals if they didn't have to, right? And so that certainly was a an interesting effect on the business and something we had to adapt to, right? So we had to make sure we carried the right inventory to supply the customers that we had when they needed it. So those are just a few of the impacts that we've noticed to the organization.
Sure. And Michael?
Yeah, I think it was, I think a lot of companies also kind of echoing what Aldo was saying, where companies that could, it seems that they were able to say, hey, we're moving into this whole new life cycle of what our day in at the office is going to look like. So being able to support your employees in such a way to say, like, here's a small, like, whatever you need. If do you need like us to ship you another monitor or something, or do you need like just a cable to connect something? Like, companies being willing to kind of make those accommodations, however small they may be, was super beneficial. And I know for pivoting towards like what Aldo had said around the, like, how did the business change? I know like our company, it generally takes a good amount of time, both for the build and just the schedule of how insurance works in the United States. It takes us a good amount of time to build out like an instance of our app, our product for a particular employer. But given the situation where we had employers pretty much saying we want to be able to offer, this was in 2020, to be able to say, like, we pay, you know, we have our service through HealthJoy, and we want to make your service, your telemedicine service the part of that service available to a segment of our employees that maybe weren't benefits eligible because of maybe they only worked a couple hours, part-time employees perhaps. So we created like on a second line of that business, or carving out that telemedicine portion, just making that available for however long the employer want to say, like, yeah, the point being, we got it out to them faster, and it provided them telemedicine access regardless of their medical insurance status. So it was something that I was delighted to see, and just one example of, I'm sure, in many different ways that companies kind of pivoted as far as the company, like, reactions to what everyone was experiencing. And I think something we'll carry moving forward is, like, what does the workspace look like in moving forward? Like, does it involve a 5-day go into the office in person schedule? We'll see. Maybe I know a lot of people are saying, like, hey, wouldn't it be nice if it was like, I don't know, 4 days, 1 day at home, something like that. We'll see what that looks like, but I'm sure my company HealthJoy will react whatever works best for our employee population, and whatever we decide as a collective country that the work week looks like moving forward.
And Ciera?
I would just say that the biggest way, so I was at the transition between organizations in the middle of the pandemic, so I got to see both worlds of it. But I would say the biggest thing that both organizations had to adapt to, and how they've changed just within the last 18 months, is accessibility. I think that's been the biggest piece. Before coming to the doctor, it was, you need to take half a day or a full day off from work, you were going to be there. But telemedicine throughout the pandemic was game changer for it all. And providers honestly have enjoyed using it. And a lot of my providers that I know, both in my current company and previously, still utilize it. If they were in the OR all morning, they'll do their telemedicine visits in the afternoon. And I think what that also has allowed for is that it's kind of like a threefold, if you will. It's allowed older patients that are very tech savvy to be able to come in and utilize the telemedicine visits and not feel that they're coming out into a clinic where, if they do have health that's compromised, that they can actually stay in the comfort of their home and take their visits and not miss out on a doctor's appointment. On the other side of it, from the provider standpoint, it's allowed a lot of them to be able to see those 6 to 7 week follow-ups, patients that truly were just coming in to be discharged, saying that, okay, no, your knee has healed or your rash has gone away. And to be able to take those 15-minute telemedicine visits now from home or wherever they are has allowed for us to be able to actually also open up our templates to be able to take in more additional new patients and see patients that more urgent care, versus sometimes where the schedules get inundated with just all of your follow-up visits, and you're trying to make sure you see new patients and a combination of the two. So telemedicine has truly helped with that. And then just from an organizational standpoint, again, just allowing providers to feel, sometimes we would say, okay, you can work half a day on a Friday, but if we can see and monitor, if I can see that my providers are working from 8 to 12 and they've got 25 telemedicine visits in that time frame, why would we need to have someone come into the office, open up, turn the lights on, open up clinic when the providers can do it from their home as well? And as an organization, you save on that overhead cost as well. So I think telemedicine has definitely changed the game for healthcare, and the working from home piece. They always said healthcare can never work from home, but we we definitely make the opportunities where we can.
Yeah, I think the proliferation of telemedicine prior, like I think just to echo what Ciera was saying in our in that segment of the industry, I just think it was interesting where before people were speculating, like, here's the thing, it's happening, let's see what happens. And then unfortunately, this pandemic really provided that catalyst to go from this might be effective to like this works for these conditions. They're like, I remember when I was speaking with employees, though, it's like if you have a cut, like a laceration, you should go to your primary care. But if you have like an earache, like a skin abrasion or something, telemedicine can handle that stuff now. So it's just kind of one of the things I'm also tracking alongside with Ciera and Aldo, I'm sure, of just so telemedicine is now kind of proven. It's kind of like a little bit. So I wonder how big that's going to be moving forward. And I suspect it will continue to grow. Just kind of one of the industry trends. Just trying to keep an eye on.
No, I definitely think it's one of those, it will continue to grow. Even as we move past post-pandemic with everything, I think it still has the opportunity, just because you even think about it, college kids, sometimes they're not able to get to the doctor, or they're not too sure, and then they're calling mom and dad. And if it's just easier for mom to say, oh no, just use the app and go on here and utilize it, then it ends up working out a lot more efficiently. And like you said, especially for sometimes those simple things where you maybe just got a cough or a scratchy throat, and you just want to make sure it's not anything terrible, or have an ear infection, something that's simple. So I definitely think it still has the potential to move forward and continue to be a evolving industry.
Yeah, and I think accessibility, to underline your point, I think that was a great point, Ciera. Just it is so much more accessible for people that maybe can't take that hour out of their workday to go to the provider's office and then whatever follow-up is necessary. If you have to go fill a prescription afterwards or something, it really does help. I do, like Ciera, I do foresee a brighter future for telemedicine. I think that was a great point, Ciera.
Thank you.
Well, thank you to all of our panelists for sharing your kind of the trends, insights, advice. I think this is really, really helpful for current students and alumni to hear from. Lisa, if you're there, I just want to give you the chance if you have any questions for our panelists before we wrap up.
Hi, everyone. Thank you, Debbie. It's been insightful. A little of the old methodologies were considered mixed with the current changes while we're in the pandemic. It's eye-opening. I have no immediate questions, but one thing I did really like that Betsy said earlier on was to listen to the questions that the employer is inquiring about. And as Michael said, be yourself and, control what you can control. And Ciera captured on, be integral, communicate that. We can have flexibility with work-life balance, provided you communicate that. So very much informed, glad I could participate, and thank you all for everything. I was taking notes, and it's funny, Debbie, you would say if you have any questions, right? Because I'm taking notes.
Oh, that's great. Thank
so
you.
Just a compliment just complimentary to everyone. Thank you, panelists.
Thank you. Thank you, Ciera, Aldo, Michael, thank you so much for sharing your career stories and your advice. Anything else, Betsy, that I'm forgetting?
I don't think so. I think that captures it really well. I'm just going to close by just sharing a quick link to the Career Center's website in the chat here that has information about our various resources and services. Just a couple that I'll highlight quickly. I mentioned our online career library that has over 50 handouts and videos and tip sheets about a whole range of topics that we've been talking about, from interviewing to developing skills and so forth. So would encourage everyone to check that out. We have a whole series of events that we do similar to this one that, talk about everything from developing a resume to, hearing directly from employers and alums working in a variety of fields. And all of that is available on Handshake. And then finally, I also just wanted to share that our career advising services, so the opportunity to connect one-on-one with a member of our advising team, are available to students and alums. So it's a great opportunity to be able to get some personalized guidance and insight based on you and your particular situation. So we look forward to connecting with folks in any of those different settings.
Thank you all so much again, and take care, and we'll talk to you all soon.
Thank you.
Thank
Thanks,
you, Debbie.
everyone.
Thanks, guys. Great one.